Hi, Dr. Susie here. Today we're going to discuss things to look for in your dog to see if they're entering the senior years of their life. And what I'm going to talk to you about are some things you can look for just in your home, in your everyday routines, to tell if your dog is becoming older and might need some extra care. The first is osteoarthritis. If you've noticed your dog taking longer to go up or downstairs, maybe even not jumping as high or as far as they have before, these could be signs of aging in their cartilage or the synovial membranes, which are just the insides and the liquids in all of the joints. After many years, it's natural for joints to degenerate, and inflammation is the response of the body, and that can actually induce pain. Around the house, you might want to consider stairs or ramps that lead to places that they're used to being comfortable on, such as a bed or a couch, right, Lena? And the other thing you want to look for is their nail growth. So it's important to have good nail care when dogs are older, as they need the pads of their feet to jump up and down and put the pressure on the pads versus having nails that are slipping all over the place. And if they have weaker joints, that could be a problem. So again, good grooming is especially important, and it actually helps with osteoarthritis in a dog's senior years. The next is kidney disease. In many animals, and including humans, it's natural for our kidneys to degenerate as we age. They don't concentrate urine as well. This can lead to many things, such as your dog maybe needing to go to the bathroom more often. And if that's the case, then you'll have to adjust your routine so that you can let your dog out more. If you're not home during the day, you might want to consider getting a doggy daycare or a dog sitter to help come and help your dog relieve themselves more often. Another issue that pet owners have to deal with an aging dog is deafness. The neurons inside the inner ear degrade as dogs age, just like in humans, and unfortunately there's no cure. One thing that people do to help manage this is if in the younger years you teach your dog some sorts of sign language so that they understand what you mean and they can kind of communicate things to you as well. So if you have hand signals for eating or pointing towards the door, if they get used to these hand signals when they're a bit younger, then if deafness becomes a problem as they age, they'll at least have that type of communication to communicate with you, and you can understand how to comfort them better. Another issue that can come up with senior dogs is blindness and loss of sight. Again, there is no cure for this. It's age-related changes to the neurons and the cells within the eyes. So getting it checked out by your veterinarian is very important. Looking for things like cornea, corneal injuries, corneal opacities such as cataracts will help you manage your dog with the symptoms they have from loss of vision. Clearly, they might be bumping into things and can't find things as easily. However, their senses are much stronger than ours, so if vision goes, their hearing and sense of smell usually pick up and can help them find cues around the house. One thing that people try to do is associate smells with different rooms. So even though a dog might not be able to see a room, they can associate, for example, the nice smell of, let's say, a lavender plant that you have in a bedroom. They can associate that with their comfort time bedroom, and they'll know which room is which. Similar to humans, dogs undergo dementia as they age. This can be seen as a loss of coordination, confusion, not knowing where to go, and overall just slower and looking a bit lost. If your dog is undergoing this, again, get your vet to check it out to diagnose it. And what you'll have to do is just be much more patient, calm, and maybe change some of your routines around the house in order to help your dog figure out where they're going. You okay? Cancer is a very common disease in aging dogs, and there's many symptoms depending on which organs are affected by cancer. Just like with humans, the treatment of it depends on the location and how early or late the cancer is caught. It can be treated with medication, with chemotherapy, or with surgery. In this case, the best thing to do is to get annual wellness and physical checks of your aging dog regularly. This way your veterinarian can pick signs up in their blood, in their urine, on x-ray or ultrasound, early indications of cancer. Then there's the lumpy bumpy dog. These are growths as well. They're not necessarily all cancerous, such as lipomas, which are mobile lumps on a dog that are benign in nature and only cause a problem if they're interfering with the function of an organ or a leg or some mechanical issue that's obstructing its normal function. These lumps and bumps are checked by your vet regularly as well on annual wellness checks. And what they can do is a fine needle biopsy. And what that means is they take a sample of the cells in the bump, they look at it under a microscope, and they can tell if it's a cancerous or benign growth. Sometimes leaving these bumps alone are just fine, and that way you avoid costly and invasive surgery for your dog. Incontinence is another issue. It's related to the kidneys, but has more to do with the functioning of the bladder and all the muscles that make it work. This can lead to involuntary urination, meaning your dog can't hold it. And while they might seem like they're going everywhere and not letting you know, they actually can't let you know because it comes so suddenly. They have loss of motor function of the muscles in the bladder. And again, you'd have to talk to your veterinarian about this, and they can either give medication or other options for you to deal with that in your senior dog. Another issue in senior dogs is obesity. As a dog ages, their metabolism slows down. They might be slower to walk, get less exercise, and also they might be eating the same amount and type of food that they were as a young adult. If you think your dog is obese or gaining some weight, check with your veterinarian again and keep constant tabs on their shape. Do they have more of a pot belly? Can you feel their ribs as easily or not? In which case you might want to consider increasing their activity level and decreasing their portion size or type of food. The issue with obesity is that obesity itself leads to other diseases. So it can lead to osteoarthritis, it can lead to cardiovascular changes and an overall decrease in health in your dog, and they'll have a lot less energy as well. So in summary, if you have an aging dog, you may have to consider your routines, such as when you take them for a walk. You might need to walk them more often for shorter walks. You might have to let them out to the washroom more often. Also, increased wellness visits with your vet are key to picking up signs of diseases that are related to aging.